Welcome back to the Canine Compass, where I help you navigate the world of dogs. I am super excited to make this video because I get to nerd out about my favorite dog subject, and that is conformation, with an O, because we are dissecting the form of the dog. Conformation. If you ever see someone spell it with an I, please correct them. It drives me insane. Anyways. As I've mentioned before in previous videos, I was once a junior show handler. Forever ago. Yes, I'm old. But my family also bred dogs for several years, and as such, I feel as though I have somewhat of an experienced eye for certain things that others may not have. It may surprise some people who know me as something of a purebred dog snob, but I actually advocate for shelters and rescue dogs and have volunteered and donated to shelters for years. I don't discriminate. I love all dogs. I'm not one of those people who just says they love all dogs and then immediately turns around and says, but I hate Chihuahuas. No, I actually love Chihuahuas. I think they're great. In fact, if I was a dog, I would probably be a Chihuahua. I really relate with what they have going on, you know? A few years ago, a friend of mine told me she wanted to adopt a shelter dog, and I was very supportive. She knew about my knowledge of dogs and asked me a lot of questions and told me all of her concerns and whatnot. Basically, it came down to what breed mixes to look for. And I told her that if she wanted a nice, sturdy, healthy, long-lived dog, then she should look for a cattle dog mix. The Australian cattle dog is a very hardy breed with few health issues. They're working dogs and often come from long lines of very healthy individuals. My friend also owned a lot of property and had livestock, so another perfect reason to look for a cattle dog. It didn't take her very long. She did eventually find a nice, young, mixed-breed dog that very closely resembled an Australian cattle dog. Within about a year, this dog ruptured both of its ACLs and required thousands of dollars in vet bills. So that sucked. But it was a lesson learned. You can't always go by what breed you think a dog is. Whatever breeds my friend's dog is doesn't even matter. The reason this dog's ligaments blew out was because of its conformation, not its breed makeup. That's when I realized that it might be a good idea to try and educate people on dog conformation to try and help them choose the right shelter dog for them. Some people go to shelters not just to pick out a new pet or a new friend. Sometimes they're there to try and choose a future service dog, or a dog they can compete in sports with, or a dog they plan on taking on a lot of camping and hiking trips. Or maybe they're just not made of money and they can't afford outrageous vet bills. They need a dog with the right temperament and a strong, sturdy structure that can withstand both physical demands as well as time. I'm also making this video so that if you do choose a dog from the shelter that has a few issues, you'll be better educated and prepared on how to properly manage it at home, take preventative measures, and keep the dog comfortable for the duration of its life. So if you don't want to buy a puppy from a breeder and would rather adopt from a shelter or rescue, and if the health and longevity of your future dog matters to you, I think this video might be right up your alley. One thing I do want to mention before we start judging structure is temperament. If you're adopting a shelter dog, remember that the breed listed on the kennel card is often an educated guess. That means the dog's behavior may not match the breed you think you're bringing home. More importantly, shelter behavior isn't always home behavior. Some really sensitive dogs completely shut down in the shelter and may only seem calm. Others become overstimulated and they bark and jump constantly, but then when you get them home, they settle beautifully. That's why I encourage people not to judge a dog based solely on those first few minutes at the kennel door. And I do know there are people out there who do this. They walk in looking for a dog that is acting a certain way, and they pick that one. Just know that a stressful shelter environment is not a good time or place to accurately evaluate a dog's temperament. That uncertainty doesn't mean you shouldn't adopt. It just means you should ask a lot of questions, spend as much time with the dog as possible, preferably in a quieter and more open area, and try to understand that true personality and temperament often takes weeks to fully emerge. What we can evaluate immediately, however, is the dog's physical structure. All right, let's get some general information out of the way. A dog's conformation is its structural and physical appearance, things you can evaluate with your eyes. I have seen a few people online asking others to help evaluate their mixed breed dog's structure, only to be met with comments stating that it's impossible or pointless to analyze mixed breed dogs because they're not purebred and they're not going to be bred. And that simply is not true. You don't need a breed standard to properly evaluate a dog's conformation. Long before dogs even had breed standards, they were bred for function. A hunting dog, for instance, with poor rear angulation, burned more energy in the field and tired faster than the other hounds. Its love for hunting pushed it beyond its physical limits, and these dogs often ended up injured, sore, or suffering from chronic pain. So these dogs were not bred. Only dogs with proper structure, and therefore better soundness, were permitted to carry on their genetics. It was not about vanity, it was about functionality. No dog is perfect. A dog with a lot of strength in one area will likely have weaknesses in another, such as trading raw strength for speed to produce sighthounds. Just be aware of what you're looking for in a dog and what your expectations are before browsing your local shelter or rescue. So without further ado, let's do this, head to tail. First things first, the eyes, the windows to the soul. Look for bright, clear, and alert eyes. No squinting, no watery or runny eyes. Look for signs of abnormalities like droopy lids or protruding eyes and rolling of the lids. Rolling eyelids are common in dogs with wrinkly faces. Make sure the sclera, the white part of the eye, is clear and isn't irritated or red or yellow. Look at the inner eye area for tear staining and excessive wetness. Some of these could just be allergies, but something like cherry eye, entropion, or ectropion, where the eyelashes rub against the cornea, do require surgical intervention for the comfort of the dog and to preserve the dog's eyesight. Next is the nose. Make sure the leather of the nose is nice and clean and doesn't appear overly dried out or scaly. This can be a sign of hyperkeratosis, which is common in some breeds, but very manageable. My own dog has it, and I just gently exfoliate her nose every day with a wet cloth. Make sure the nostrils are nice and open. The dog can breathe normally and isn't breathing exclusively through its mouth. A dog at rest should breathe through its nose. When it is panting, it shouldn't sound raspy, wheezy, or labored. Snorting while breathing can be a sign that a dog's airway is obstructed, usually by excessive tissue, such as the soft palate, nasal polyps, or an overly large tongue. You are more than welcome to adopt these dogs, of course. Just know that you probably won't be going on any hikes with them. If the dog's breathing issues are severe enough, it may require surgical correction, which can be very expensive, risky, and insurance may consider it to be a pre-existing condition and will not cover it. The next thing is muzzle length. Now, I know a lot of people are really hung up on the idea that all brachycephalic breeds can't breathe. It is not true. Anyone who has owned a well-bred pug or French bulldog will tell you their dogs could breathe just fine. If you don't want a brachycephalic dog, then don't adopt one, but I'm just saying not to immediately judge the dog. Ask the shelter staff if you can take the dog for a quick walk, and judge for yourself if that short snout is really going to cause breathing issues. But do take note that brachycephalic dogs are typically heat intolerant. Most dogs are going to be mesocephalic. This is the more natural shape of the head and muzzle. There are also dolichocephalic breeds with a long, narrow muzzle and skull, usually seen in sighthounds and some collie breeds. Dogs with this head shape are more likely to have dental issues caused by crowding and malocclusion, as well as fungal infections of the sinuses, Keep their teeth clean and be aware of any nasal discharge. Next is the dog's bite. This is how the dog's teeth come together. Ideally, a dog should have a scissor bite. Some may have an overbite, an underbite, a level bite, or on the rare occasion, a wry bite. Most of the time, an abnormal bite causes no issues, but occasionally you may have problems with teeth rubbing in the wrong places, causing sores and enamel loss. If your dog's bite is so bad that they have exposed teeth, these teeth will need to be cleaned regularly. Occasionally, a dog's bite can cause jaw pain and may require medical intervention. Since we're already on the topic, let's talk about teeth. Some shelter dogs have had a rough life, and they may have missing or broken teeth. I've also seen some dogs with badly worn teeth, usually from trying to chew out of a chain or a fence. Look for heavy tartar, discoloration, fractures, chips, etc., and bring up your concerns with your veterinarian. Next, let's take a look at the dog's head as a whole. As stated previously, some shelter dogs have had a pretty rough life. Some are survivors of previous injuries. Look for symmetry in the dog's face and head. Look for signs of possible nerve damage, like drooping, dropping food, chewing on one side of the mouth, blinking unevenly, swelling in the jaw. Sometimes these issues are completely benign and caused by an old, healed injury or birth defect. But if it's causing the dog pain, this could add up to a large vet bill later. Let's move along to the top of the head to those keen ears. Ears, like dogs, come in a wide variety of shapes and sizes. My personal favorite is the button ear of the Irish Terrier. Now, most dogs in shelters are receiving vet care if needed, and if they have any issues, the shelter staff should let you know, but still be on the lookout for dogs with really long, heavy, floppy ears. These types of ears close off the ear canal to fresh air and tend to trap moisture and can be a breeding ground for bacteria. This is even worse if compounded by a poor diet, allergies, and longer coats. Hair growing in a damp, dark ear canal is just asking for an ear infection. Be on the lookout as well for ears that appear scarred, thickened, or misshapen. This can sometimes indicate previous oral hematomas, usually caused by excessive scratching or head shaking, a symptom of ear infections. A dog with scars from previous hematomas may be predisposed to ear infections. Not a deal breaker, of course. My last shelter dog was prone to ear infections. Just be sure to keep on top of ear sanitation, allergies, and proper diet. Next, let's look at the dog's skin. Be on the lookout for patchy hair loss, scaly, scabby skin, redness, inflammation. The skin around the eyes, lips, chin, and bases of the ears is a good place to look if the belly isn't fully visible. Sometimes these issues can be caused by diet. A lot of dogs in shelters are mixed with pit bull and other bull breeds, which are prone to allergies and food sensitivities. Some dilute dogs are also prone to alopecia, so blue and charcoal dogs, or gray to the average person, may have a thinner coat than some. Next, let's take a step back and evaluate the whole dog at a glance. Does this dog appear balanced, or does he look like he was assembled with spare parts? Some people really like a unique, goofy-looking dog. There's nothing wrong with that. Just be aware that a dog with a long, heavy body on short little legs might eventually have some orthopedic issues. Next, let's talk about what the head is attached to, the neck. My dog has a short neck, very common in bull breeds. A short neck shortens a dog's stride. If you don't believe me, look up any photo of a trotting or running dog and you'll see the foot doesn't go much further than the dog's nose. So naturally, the shorter the neck, the shorter the stride. The shorter the stride means more steps, and more steps means the dog gets tired faster. Dogs with longer necks will have some difficulty in certain tasks, such as swimming. This is why retrieving breeds never have long necks. However, the longer the neck, the longer the stride. This is why long necks are common in sighthounds. The only issues I can think of for the neck has to do with the base of the neck, right at the withers or the top of the shoulder. Keep a sharp eye for dogs with flat or shallow withers. A flat wither is a sign of an insufficient area for shoulder muscles to attach to. This will limit the dog's movement, cause increased concussion on the front limbs, and cause soreness in the dog's back. Also, dogs with short necks have trouble swimming. If you're looking for a shelter dog to take to the lake or the beach, a dog with a short neck will need a life jacket with a special attachment to help hold his head above the water. Now let's move on to the shoulders. For the most part, you want a dog to have a good shoulder angle. For more active dogs, a well laid back shoulder is beneficial and stands up better against injury and wear over time. Terriers tend to have a more upright shoulder to allow for stronger digging abilities, which is what terriers were originally bred for. Since terriers are typically smaller, the wear on joints is less substantial. For larger, heavier dogs, a short upper arm and a steeper shoulder angle can place the front legs too far forward and put excess strain on the joints, ligaments, and muscles. Dogs with this type of conformation should be discouraged from jumping off beds, couches, and the like, as their weight is unbalanced and already placing too much stress on their front end. Moving down the front legs, let's talk about elbows. A dog's elbow should be tight against the rib cage without being turned in or out. A good way to tell the proper angle of the elbow is actually to look further down the leg at the feet. Feet turned in or out could be an indicator for the angle of the elbows. This causes instability in the joints and leads to arthritis and strain on ligaments, and these dogs should also be discouraged from jumping off furniture. Further down the leg, we have the complicated carpal joints, also known as the wrist. Some dogs may have easty-westy feet, which is common in dogs with dwarfism, but can also be caused by bad conformation, genetics, poor nutrition, or injuries. These dogs tend to develop arthritis and may be very reluctant or even aggressive if their paws or legs are handled or manipulated. Below the wrist is the pastern. A well-angled pastern is very important. A pastern that is too upright does not perform the function of a shock absorber, increasing the strain on the legs. A longer pastern is typically seen on sighthounds. Dogs with short pasterns should be discouraged from higher impact activities like jumping. An over-angulated or collapsed pastern is a sign of tendon laxity and often seen in young, large breed dogs going through growth spurts. They can also be genetic and are often accompanied by splayed feet. Take a look at the nails as well. They may not offer much information, but odd wear can be a sign of the dog dragging its toes or walking strangely to either favor a limb or compensate. Speaking of feet, the ideal dog paws are compact with well-arched toes for gripping and maneuvering. A dog with longer toes tends to be quite fast, but not necessarily the most agile at making those tight turns. Beware of flat, splayed feet. Though these can sometimes be corrected with special exercises, it's usually genetic and very difficult or impossible to correct. Take a look at the dog's pads as well. Look for unusual wear or calluses that may signal chronic compensating gaits. Next, the structure that attaches the front assembly to the rear assembly. Your dog's back is a very important tool when assessing the dog's overall conformation. Depending on the construction of its front and rear will determine whether the top line, or top of the back, is gently sloping, flat and level, roached, uphill, downhill, swaybacked, and so on. An overly long back is often accompanied by weakened muscles, which can break down over time. A short back can be too compressed and lead to issues with the intervertebral discs. Dogs with a muscular arch to the loin are typically speedy boys. Those with a straighter, more level top line are built for strength. Sometimes a hunchy back can also be a sign of abdominal pain, and a high rear coupled with straight rear legs could be a compensatory stance to take weight off the rear end due to discomfort in the hips or stifles. I personally believe the ideal top line should be level. This offers the best balance and equilibrium for the dog as a whole. Now let's discuss what is at the end of that top line, the tail and the croup. The croup measures from the pelvis to the base of the tail. A steep and rounded croup is typically caused by a compensatory stance where the dog is standing under itself due to conformation anomalies or possibly even pain. A flat croup, however, could be a sign of a stiffened, uncomfortable back that limits the range of motion of the rear legs and shortens the stride length. The tail could be important to some dogs. Communication is obviously lost when a dog's tail is either missing or compromised in some way. A tail can also act as a counterbalance. When the tail is lost or restricted in some way, the dog is forced to compensate, which could put undue strain on the spine. Also, keep an eye on the dog's tail when it's walking or trotting. The tail jerking and twitching to one side is often a subtle sign of a limp. Next, I'm going to go into the rib cage and the chest. A chest that is too narrow or shallow will limit proper respiratory function, though an overly deep chest can increase the likelihood of bloat, a very painful and life-threatening condition that affects the stomach. A wide chest limits the swinging of the front legs and shortens the dog's stride. These dogs are typically front-heavy and very poor swimmers. Now, a very important note before we move on, dogs are rear-driving animals. Anyone familiar with cars will know what that means, but in animals it simply means that the rear legs are ultimately what propel the dog forward. Improper construction of the rear can cause undue wear and stress on the joints and ligaments of the legs when the dog is jumping, landing, swimming, and so on. Remember when I mentioned my friend's shelter dog earlier, the one that ruptured its cruciate ligaments? It was because of the dog's conformation. A dog that lacks rear angulation and is straight through the stifles will load excessive weight on those stifles when it's running, jumping, landing, and this can eventually lead to cruciate ligament tears in the stifles. If you adopt a dog with straight rear legs, be sure to have ramps or stairs for your furniture, rugs for slippery floors, and keep any excess weight off the dog. My last shelter dog was very straight in the hind end, and with preventative measures, we successfully avoided cruciate ligament injuries. Angulation of the rear legs is very important. Those poses you see dog handlers at shows performing is called a stack. Stacking the dog shows off its profile so the judge can properly assess the dog's angles. To determine if a dog has proper rear angulation, trace a straight line from the back of the thigh down to the ground. The dog's rear toes should align with the vertical line. A dog standing in front of the line lacks rear angulation, or turn of stifle, and a dog standing far behind the line is over-angulated. A little bit in front or a little bit behind this line is okay, just not ideal. But far in front or behind is definitely undesirable. Some breeds are naturally more angulated than others. I personally believe it's best to be on the vertical, but if the dog is slightly off, I think it's far better to be slightly over-angulated than under-angulated. Now let's look at this dog. Is he over-angulated? If you said no, good job. This dog is actually overstacked. Remember, a dog's rear angulation can only be accurately assessed if the hock is straight and perpendicular to the ground. The hock is an important joint, and its stability is crucial to a dog's mobility and agility. The hock is the equivalent of your ankle. It's a complicated joint and should be straight when viewed from front or behind. A dog shouldn't be barrel-hocked, sickle-hocked, or cow-hocked. The hock should have a good angle and shouldn't be straight when viewed from the side. Now, all of these conformational aspects, all put together, culminate in the movement of the dog. Hopefully, whatever shelter or rescue you're visiting has an outdoor area. If not, ask shelter staff if you can take the dog for a walk, or ask a staff member to walk the dog so you can see how it moves. Keep an eye out for uneven head bobbing, short strides, a skipping gait, or more obvious limping or lameness. A dog with luxating patellas or damaged cruciate ligaments may be resistant to bending their knees and will swing the hind legs to the side rather than keeping the leg under themselves. Keep a lookout for crabbing, crossing over, skipping, scuffing, swaying, anything that just doesn't look quite right. You may even want to video the dog and analyze screenshots from the video, or slow the video to watch the dog in motion better. Also evaluate when the dog is standing. Does the dog stand still, or does it constantly shift its feet and appear uncomfortable? Beware of compensatory stances where the dog avoids putting weight on certain legs. Take stock of the dog's muscling. Often shelter dogs are going to be under-muscled, but be especially sure to look for symmetry in muscling. An atrophied leg can be an indication of chronic lameness and a big vet bill. Now let's evaluate some shelter dogs. These are just images of some dogs currently, or at least at the time of this video, up for adoption at my local shelter that I've actually volunteered at. An image of a dog can be a good first introduction to help you decide if you want to go visit that dog in person. It isn't perfect, of course, especially when there's only 1 or 2 photos of the dog at poor angles. But as I said, it can be a good start. Alright, this first dog is definitely some sort of pit bull mix. He's got nice tight feet. I like the angle of his shoulder. I like his top line. I like his rear angulation. I like his tail. His head looks a little bit too big for his body. The muzzle looks like a good length. The teeth look good. The nares are nice and wide. The eyes look a little crusty. And I would have to look in those ears. Those are the kinds of ears that tend to trap bacteria, and they can get infected. Alright, this next dog, he looks a little narrow in his front stance. So maybe his chest is a little narrow. His teeth, I would need to look at his teeth. Judging by the color on his face, he looks like he's an older dog. His eyes look nice and bright. Top line looks good. Rear angulation, I can't really see from this angle. It looks a little straight, but I'm not 100% sure. The main thing that stood out to me about this dog was his front pasterns are very straight, and he's very flat-footed. His toes are, like, not arched as well as they could be. Definitely something to keep in mind. If your dog has flat feet, he can get arthritis. This next picture, this dog looked to be in pretty good condition. I did see other pictures of him, but I chose this one just to point out that these shelter dogs are going to be a little rough around the edges, and this one has some pretty obvious scarring on his nose. This dog came in with 2 others. They looked to be related. They were the same color. They looked like they're the same breed mix. All 3 of them were in really, really bad condition, very neglected. You can tell how long the nails are. When a dog's nails are overgrown like that, it can throw off their posture. I wouldn't evaluate this dog's conformation simply because he's not going to be standing correctly because his nails are not only overgrown, but they've been overgrown for a long time. And other than that, it's pretty obvious what his biggest issue is, and that is he clearly has a lot of hair loss. This dog might have mange, but he can also have a flea allergy. He's got a lot of crusties around his eyes too, so it's gotten into his eyes. I really hope this dog receives the treatment he needs, along with the other 2 that he came in with. This is another one that he came in with. Lots of patchy hair loss. This one doesn't look quite as sad. That first one looked really sad. And then here's the third one. Again, this is the female. Again, long nails, and she's really crusty around her eyes, and she's got a lot of thin hair, a lot of hair loss, a lot of scabby, scaly, very dry, irritated looking skin. Another one that's a good example that these dogs are not going to be perfect. This one is blind in one eye. I read the bio for this dog, and according to the vets that have seen him, the eye is not causing any pain or any discomfort, and he's totally blind in it, but he could still make a great dog, obviously. This dog is another one that seems to be having some patchy hair loss. It might be the angle of the camera, but it also looks like he might be a little flat-footed. You can see some crusties in his ears. The ears look like they're really dry and flaky. And then if you look a little further back, you can see he's not in the best condition. He could definitely use some more food. This dog was one of the few that I got a good side view on. Now this one's not standing perfectly square, but I really like her muscle tone. She has really nice muscle tone. Maybe she hasn't been there for very long. She is straight in the hind legs. That is something I would be concerned about. She is very straight through those stifles. But her hock is not straight, so this may not be her natural stance. But I kind of think from looking at her, even if she was standing square, she would still be pretty straight. I like her top line. Again, she's a little high in the rear because she's so straight. in the hind legs. But other than that, she's got a good angle to her pasterns, and I like her feet. She has nice feet. I really like her shoulder. The shoulder is really nice, very muscular, a very good angle, nice prominent withers. Now this one, I did read his bio multiple times to make sure I wasn't missing anything, but it does not mention whatever this is going on the side of his face. I'm not sure what that is. I would have to get my hands on this dog and feel that. You know, is it firm? Is it soft and pliable? I'm not sure what that is. I'm not sure if that's swelling. I don't know if that's a growth. I'm not sure what that is. So just something to keep in mind when you're looking at these dogs. Look for symmetry, because, I mean, that's going to stand out when the dog is not symmetrical. So there's something going on with this dog's head or face. They didn't feel like they needed to mention it in his bio, so maybe it's completely harmless. Who knows? Now this dog, unfortunately, is the product of two Merle dogs. Now when you breed a Merle dog to another Merle dog, you can sometimes get a dog that inherits two copies of the Merle gene, which causes blindness, deafness, a pure white coat. It can cause other issues. This dog, I read in his bio, he's deaf and he's blind. And so he's special needs. He needs a special kind of adopter. This dog was another one that I got a fairly decent side view of. This one has a little better rear angulation than that other dog that I got a side view of. And the bandana is kind of throwing me off a little bit, but this dog does look very straight and very upright in the shoulder, which is not ideal, but, you know, not a deal breaker. Just don't want to let this dog jump off couches and beds and stuff too much. Other than that, she has a nice top line. She has a nice expression. That mottled tongue kind of makes me think that she might have some chow in her. That would be interesting. Her front pasterns look a little upright, but her feet are really nice. They're nice and compact, and they're nice and arched. Now this is a bulldog. I absolutely love bulldogs. They're one of my favorite breeds. I picked this one because she's got a very strange stance. She almost looks like her legs are kind of rubbery. And there's a reason for this. Right before females give birth, their tendons and ligaments get really loose. They get a lot of tendon laxity. So I wouldn't judge this dog's conformation if she was in heat, pregnant, about to give birth, or lactating. This one, she does appear to be lactating, which can cause laxity in the joints and the ligaments. So it wouldn't really be a fair assessment for her. Now this dog is my kind of dog. I think she's absolutely gorgeous. She has a really nice coat. I really like the angles of her rear and her front. I like those nice, bright, alert eyes. I love her top line. The only thing I don't like, it looks like her front feet have like long, flat toes. That's not exactly ideal. I'd much rather have a dog that's much more up on their toes. This dog is pretty cute. I picked this one out because she's standing slightly toed in, meaning that her feet are turned toward each other a little bit. Now, this could just be a moment in time when this picture was snapped and she doesn't normally stand like this, but it's just something to keep in mind when you're looking at pictures of dogs. This one, I was pretty concerned about the way she was sitting. This could be a sign of hip or patella issues. This dog also appears to be older. She's kind of gray in the face. I would be concerned that this dog was pretty arthritic. This dog was actually adopted. I took this picture because his front feet are turned in and his elbows are turned out. That kind of touches on something I mentioned earlier, where you can tell if the elbows are turned in or out by looking down further at the feet. So if this dog's feet were turned out, his elbows would likely be turned in. Now this may just be a moment in time, and this dog doesn't actually have any conformation issues with his front legs, turning or twisting or whatever. This could just be the photo. But judging by the photo, he looks like he's toed in. And this one, last but not least, this is also a lactating mama, but I took this picture because I noticed something back here on her right rear leg. This looks like it could be just a lipoma, which is just a little fatty growth. Could be something to make note of if you're looking for a shelter dog. Make sure they don't have any strange lumps and bumps that the shelter can't explain. To wrap things up, while we can't always predict a shelter dog's temperament or personality, we can learn to better understand how that dog's body works. My hope is that this video has given you the tools to recognize sound structure, identify potential concerns, and better prepare for the unique needs of whatever rescue dog steals your heart. Remember that no dog is perfect. Every dog is a collection of strengths and weaknesses, and it's just as important to recognize a dog's good qualities as it is to understand the physical limitations they may face. Conformation isn't about judging a dog's worth. It's about helping them live the healthiest, happiest life possible. I wish you the very best of luck in your search for your future shelter dog. If you know someone who's thinking about adopting, feel free to share this video if you think it may help them. I have lots more videos planned, so stick around and subscribe if you don't want to miss them. As always, thank you for watching, thank you for caring, and I'll catch you next time.